Health insurance. In this section, we will explain the options, costs, and requirements associated with health insurance. Besides housing, transportation, and taxes, healthcare expenses make up one of the most significant costs for most households. Even for routine healthcare, costs can be exorbitant. Health insurance allows individuals to manage the unpredictable and potentially excessive costs associated with healthcare. Consider this chart from the National Center for Health Statistics. The cost of a routine hospital stay can run upwards of $10,000 depending on the medical need. And these costs tend to increase as you age, both in terms of the insurance premiums you must pay and the out-of-pocket expenses. However, healthcare is not just for the elderly. Consider that about 25% of young adults visit the emergency room every year. Almost 50% of young adults will visit the doctor at least 1 to 3 times in a year, and around 10% will have more than 10 visits to a doctor or hospital during the year. This means even if you are in your 20s, you have about a 1 in 5 chance of spending $800 or more in healthcare costs each year. With nearly all types of insurance, but health insurance especially, there are 3 kinds of out-of-pocket costs that you should be prepared to bear. The first is your monthly premium. Whether or not you use the insurance or not, you must pay the monthly premium to retain coverage. The second is your deductible. This is the amount of money that the insured must pay before any insurance kicks in. In general, the higher the deductible, the lower your monthly premiums will be. For insurance policies with high deductibles, there's generally not a copay. However, policies that have low or no deductible amounts, there's usually a nominal copayment generally required anytime you see a doctor or fill a prescription. Lastly, some insurance policies may also have coinsurance provision, where for certain procedures or locations, your health insurance will pay most of it. A common coinsurance breakdown is 80-20. To mitigate all of these out-of-pocket costs to the insured in potentially catastrophic health emergencies, most policies do offer a maximum annual out-of-pocket amount, meaning once in total you've paid, for example, $10,000 in deductibles and coinsurance, expenses above this cap are covered entirely by the health insurance company. Preferred Provider Organization, or PPO plans, generally give the insured the most flexibility and options when it comes to what doctors and hospitals they can receive care from and still be covered by insurance. But because it offers them the most flexibility, this type of plan is also the most costly. Health Maintenance Organization, or HMO plans, generally limit you to a pre-approved network of physicians and hospitals in your area. Because the insurers already pre-approved these providers, you generally have a small copay as long as you stay in network. A point of service or POS plan is a hybrid of the two. You are still encouraged to use the pre-approved in-network providers, but you may go out of network for specialist care if you have received a referral from an in-network provider. Individuals and families covered by a high deductible health plan are also eligible to open a health savings account. A health savings account, or HSA, allows you to save money on a tax-free basis that can then be used to pay for qualified medical expenses down the road, such as the deductible and other out-of-pocket expenses. High deductible policies have the lowest monthly premium, leaving you the extra cash flow to save into an HSA. We will talk more about this later, but an HSA is the most powerful tax-advantaged savings account. Through the Affordable Care Act, all Americans have access to health care via the health insurance marketplace. If health insurance is purchased through the government website, healthcare.gov, individuals may also qualify for an advanced premium tax credit, which is a subsidy from the federal government that helps lower the cost of health insurance. As I alluded to earlier, HSAs are incredibly powerful savings tools. As long as you maintain a high deductible health plan, you are eligible to make tax-deductible contributions into an HSA. Within an HSA, you have the ability to invest funds on a tax-deferred basis, And as long as you ultimately use these funds to pay for qualified medical expenses, the money you withdraw, both contributions and earnings, comes out tax-free. It's the only type of savings account that has a triple tax advantage.
Answer verbal question 2 now. Which savings account has a triple tax advantage? Pause and answer lecture verbal question 2 now.
Sadly, very few people take full advantage of their HSA as a retirement savings vehicle, as many of the expenses you'll have in retirement do ultimately fall under qualified medical expenses. An HSA is a great chance to save for retirement. Flex spending accounts also allow you to put tax-deductible money aside for healthcare expenses. But unlike an HSA, you must use your yearly contributions within that plan year. Use it or lose it. Allowable expenses are slightly broader than for an HSA, and in many cases can also cover childcare. Ideally, you can have both an FSA to cover immediate health expenses that you already know about, and an HSA to cover needs down the line. Test your knowledge of out-of-pocket expenses by answering this question on your own.
Answer verbal question 3 now. How much will he have to pay out of pocket? Answer verbal question 3.